I'm Charles Wykoff. I'm an ophthalmologist, specifically a retina specialist from Houston, Texas. I'm part of the Retina Consultants of Houston. Diabetes is obviously a big player. We live in a world where the prevalence of diabetes and obesity continue to rise. And among patients with diabetes, the earliest and the most common end organ affected, in other words, the part of their body that's affected earliest and most commonly, is the eyes. So the eyes is a huge source of problems for patients with diabetes, and yet a huge source of hope because they're really good treatments for diabetic eye diseases. So in patients with diabetes, with eye diseases, the most common manifestation of diabetes in the eye is something called diabetic retinopathy. The retina is the back of the eye. It's the part of the eye that senses the light that comes in. It is a highly vascularized tissue, and because of that, diabetes often causes problems in that very delicate tissue. But most patients with diabetic retinopathy don't have any symptoms at all. They're just walking around and they think they're seeing just fine when they can have very severe disease in the back. Now, once a patient notices it, it's like most eye diseases. It causes blurry vision, but that is such a vague statement that it's hard to communicate to patients really what that means. Some people say they can't read things as well. A lot of people think their glasses are just out of date, but in fact, it's not a glasses problem. You can switch the glasses all day long and it won't make any difference if you have significant vision decreasing diabetic retinopathy. And I'd recommend any person that's over the age of 10 years of age get a screening exam at diagnosis. Certainly the critical issue for patients in screening for diabetic eye disease is to make sure they're engaged with an eye care professional that can examine their eyes, identify diabetic retinopathy, and get them referred to the right resources to manage that disease. And the core examination step there is a dilated eye exam. So once someone is diagnosed with diabetes and they get their baseline screening exam, they should be getting at least annual exams from there forward. Diabetic retinopathy is a broad spectrum of diseases. There's really three forms that can cause vision loss. By far and away the most important and the most common is diabetic macular edema, or DME. But to round out the list of what causes vision loss from diabetic retinopathy, we should add proliferative diabetic retinopathy, which is where abnormal blood vessels grow and bleed in the back of the eye, which can cause severe vision loss, can cause blindness as well. And then the third one is really ischemia, which is a portion of the first two for sure, but it's where diabetes causes loss of the normal blood vessels in the back of the eye, and that in and of itself can cause vision loss if you lose blood flow to the normal parts of your retina that you need for vision. Certainly the cornerstone to management is blood sugar, blood pressure control. When a patient is very well controlled, they can still get vision loss from DME and other forms of diabetic retinopathy. In that case, really intraocular treatments are the best approach that have been proven. But controlling blood sugar, controlling blood pressure, controlling cholesterol are critical. The other factors that you want to consider are smoking. So smoking is like fuel on the fire for many eye diseases, diabetic eye disease included. So if you can, stop smoking, decrease the amount that you're smoking. Other risk factors to be aware of are things like anemia, renal disease, and there are some specific kinds of medications that people may be taking orally that can exacerbate swelling of the back of your eye. If you have either proliferative diabetic retinopathy or DME, most common causes of vision loss from diabetic retinopathy, there are very good treatments for these. The much newer treatments that are now been proven in multiple trials are medications that are injected directly into the back of a patient's eye to decrease the swelling and improve vision. And these medications fall under two categories. By far the most commonly used medications are medications that block a very specific growth factor called VEGF, or vascular endothelial growth factor, in the back of the eye. And then there's a class of medications known as steroids, which have a more broad effect to decrease inflammation and cause decreased swelling in the back. There are 4 medications that are FDA approved for the treatment of DME, all which are given by direct injection into the back of the eye. Point to patients, you hear that these medications are given by direct injection into the eye. That often catches patients off guard that haven't heard about this before. It certainly would me if I'd never heard about it. Patients will look at me and say, "Doc, you're going to put a needle in my eye?" And the answer to that question is simply yes, but fortunately, we've done this for so long now as a community and as a field that we've gotten really good at it. And the vast majority of patients should not really have any pain. They should barely feel it at all.